Now to another breaking story out of Texas, this time in the border city of Brownsville. That's where someone drove their vehicle into a group of migrants outside of a shelter run by Catholic Charities, killing 7 people and injuring 12 others. Brownsville police say the driver has been arrested and charged with reckless driving, with more charges likely. A senior law enforcement official tells NBC News that it's not yet clear if this was an intentional act, but that is part of the investigation. This deadly incident comes as concerns intensify at the southern border because a pandemic policy called Title 42 is set to end in just 4 days. Now, under Title 42, the United States has blocked at least 2.5 million migrants from crossing the border since 2020. Title 42 allows people to be expelled immediately without an asylum hearing. Well, on Thursday, that policy will expire. The end of Title 42 is sparking fears that the surge in people seeking asylum will overwhelm border processing centers. Homeland Security Secretary Alejandro Mayorkas visited Texas this past week. There, he talked about new policies and increased regional aid that he says will have the nation prepared.
We will, by May 11th, finalize the rule that we published in a proposed format that provides that individuals who do not access our lawful pathways will be presumed to be ineligible for asylum and will have a higher burden of proof to overcome that presumption. The border is not open. It has not been open, and it will not be open subsequent to May 11th.
But the surge of people at the U.S.-Mexico border has already begun. Customs and Border officials say border apprehensions in the Texas Rio Grande Valley now average around 2,000 a day. These numbers aren't abstract by any means. There's a human being, unimaginable hardship, and arduous journey associated with each one. Seeking asylum in the United States is legal. The crisis lies in whether our nation has the capacity to process each asylum claim and guarantee humane treatment as every decision is made. An NBC News poll from January found that 80% of Americans think Congress should provide a pathway to citizenship for undocumented immigrants who meet certain requirements. 72% of folks polled think it should boost funding for border security. Americans want to see immigration reform. Frankly, it's needed. But it's Congress that has failed to listen and act. There has not been a federal immigration bill signed into law in more than 25 years. So with the gridlock Congress and a White House with limited powers, how are local leaders navigating this class of obligation and capability? Well, here to discuss is the mayor of Laredo, Texas, Dr. Victor Trevino. Welcome. Mayor, you are the mayor of a border town. Do you feel that your city is ready for Title 42 to expire?
Well, thank you for having me first. I've grown up here and have been a doctor all my entire life. So as someone who lives here, our immigration challenges have existed all my life. Now, the issue now is that the volume has grown to an unmanageable level because we have ignored what's coming up with a solution. And Laredo, frankly, does not have the resources to absorb the level of migrants that are being projected to cross over and then be transferred to us. We don't have the crossing as other border cities, but we're going to have the transfers because we're a processing center. I have communicated this to our Congressman, Henry Cuellar, who's also talking to Secretary Mayorkas. So we need to have a structured plan for the transfers to us because we can get overwhelmed, and especially our hospitals. We're medically underserved. We have a deficit in the medical infrastructure, and we saw that during the pandemic. So that's very concerning. And I'm treating this like a hurricane, so I'm asking for the resources to start now, like boarding up for a hurricane. You board up before the hurricane hits. So at this point, we have to get any help we can in any part of the United States where they have room or shelters that we can refer the migrants to.
So you recently told Politico that you needed an additional $11 million to absorb the expected influx that you're going to see due to Title 42 being lifted. Now, Secretary Mayorkas has said additional funding is, in fact, being distributed. Has your city gotten any of that money yet? If so, how much? And if not, what have you heard?
Yes, we have been told we're going to get some funding through FEMA, but it hasn't come yet. So the 11 million are for the amount of people that will be sent here. Like I said, we don't have the influx of migrant in our border, but it will be the same thing when they're sent here for processing. Our NGOs can only handle not even a fraction of that. So we will be overwhelmed. Everybody could potentially wind up in the streets. So we have to have plans for this. We have instilled our local emergency management plan, and we're trying to get rec centers and park and ride areas ready for this. But for that, of course, we need funding.
My last question to you in the time we have left, Mr. Mayor, is how are you balancing the needs of asylum seekers with the needs of Laredo residents, particularly when it comes to things like maintaining access to services like hospitals, for example? You talk about not having the infrastructure and hospitals being overwhelmed. How do you balance it all?
Well, these are federal problems that we're having to handle ourselves at a local level. And we've been medically underserved for decades. We cannot have all this overflow of people. We just can't handle them. We have, as we speak, we can only man about 66% of the total capacity of our local hospitals. So if we have this big influx, that will cause a devastation. We have to look at this. As a doctor, we will treat anyone and everybody. We can't turn anybody back. But that poses an issue, is that where are resources, and are we able to handle this?
Laredo, Texas Mayor Dr. Victor Trevino, thank you very much. We will hopefully be chatting in the coming days and weeks. Appreciate your time.
Thank you for having me.